Okay, here are 3 cosmetic procedures that I think are going to be the it procedures in 2025. I'm a celebrity dermatologist that practices in Beverly Hills as well as Tucson. So I see a lot of kind of what's coming, what people are asking, and what's really down the pipeline in our field. So number 1, I think that this undetectable filler trend is going to continue to happen. I think that people were really, people went overboard with filler, and then people got really scared with filler. And I think people are gonna really understand, okay, wait, filler isn't that bad, but let me do it correctly. Let me make sure I'm going to the correct provider who is able to really, I call it like micro filler, where I take 1 or 2 syringes, put a little bit, quarter, so it's undetectable. And yes, you may need several sessions. It may dissolve a little bit quicker, but guess what? That means your body's able to get rid of foreign materials, and that's not necessarily a bad thing. So let's not vilify filler. It's coming back, but I think in a different way. Number 2, biostimulatory injectables. So these are things like Sculptra and hyperdilute Radiesse. Hyperdilute Radiesse I've been using for a really long time. So Radiesse is a type of filler. It's calcium hydroxyapatite. And what we do is we kind of dilute it down. So it adds a little bit of volume, and that's why I like to use it over Sculptra, because it has that immediate volume, but it also is biostimulatory, which means it stimulates collagen over time. Sculptra, it comes in a powder. We dilute it down with water. This usually requires several vials, but usually for my younger patients, I'll do 1 vial a year. And this really helps stimulate that collagen. Yes, plastic surgeons have said, okay, Sculptra can cause scar tissue and it makes a facelift harder to do, but I think that any really great plastic surgeon will see past that. And if you're only doing 1 or 2, maybe 4 max a year, and your body isn't getting mixed up and your face isn't getting mixed up with other types of filler from other companies, that risk of your body creating scar tissue or an inflammatory response is very low. And quite frankly, sometimes we want that inflammation because that is what tightens. So don't be afraid of Sculptra. This is something that is beautiful. It's been around for a really long time. And that is what I think the people are gonna be gravitating a little bit more to. It just requires a little bit more education. And then along the same lines is like something like Easy Gel PRF. PRF is a little bit more regenerative, which is platelet-rich fibrin, versus PRP, which is just pulling in those stem cells for a couple hours a day versus like months with PRF. So one brand is Easy Gel Filler. I have it in my office too. This doesn't necessarily add a lot of volume, but not everyone needs volume. So it helps with skin quality, the blueness, and adds a little bit of volume because it's stimulating your own body to stimulate that collagen. And a lot of these biostimulatory fillers, especially Sculptra, we've noticed that they actually stimulate fat too, which is what we want in the face. So we want fat in the face because we lose it over time. Number 3, this has been really huge in my practice, especially this year, and that is Tumescent Mini Awake Liposuction. So it's liposuction. Of course, I'm not endorsing any of this, but I think people are understanding that doing some of the non-surgical things are adding downtime. You're taking off from work. You're spending a lot of money and the results aren't there. So going in and doing something a little bit more of a procedure, but something where you're awake, where it's still safer, low downtime, lower morbidity, mortality risks, because we're not going under general anesthesia, is such a great option, and especially jawline. So double chin and neck liposuction. I'll put some of my before and afters here. And this is just such a great and underrated procedure. Kind of the patients who know. And I have had amazing before and afters, and patients truly say that this is the one thing that they wish they did sooner and they're just so glad to do. And so I think that people are really gonna understand that a lot more in 2025, and the options of kind of this like awake procedures that are very, again, curated for you. They're not too intense, but they're there because, let's be honest, plastic surgery and cosmetic procedures, they're not going anywhere, but I think people are getting smarter about it, and I think that's awesome.